Heart failure is a big problem in this country. Heart failure is basically when the blood backs up because the heart can't pump it fast enough, and it backs up into the lungs and causes congestion, hence the term congestive heart failure. About 5 million people in this country suffer from congestive heart failure, and over 1 million patients are admitted to the hospital with decompensated congestive heart failure every year. Right. The problem is diagnosing it early enough to intervene. The primary treatment are medications called diuretics, or patients will refer to them as water pills, to try to get rid of the extra fluid before it gets to the point where it backs up into the lungs. There's a big problem with readmission. Frequently, after patients are discharged from the hospital, there's about a 25% readmission rate for congestive heart failure within the first month, and about 50% within the next 6 months of patients having to be readmitted to the hospital. Trying to diagnose congestive heart failure before it gets severe enough to require hospital admission is somewhat difficult. Even an experienced heart physician with a stethoscope and exam can't always tell whether the patient is slipping into congestive heart failure. Just like a traffic jam, before you have a traffic jam, the traffic starts to slow down first. If you have a way of detecting the slowdown before it becomes a full-fledged traffic jam, then you can take measures with medications to try to relieve the congestion downstream before you end up with all the traffic stopped, which would be full-blown congestive heart failure. What happens is when people's congestive heart failure is well treated, the blood flow through the heart is normal, and the blood is not backing up into the lungs. The pressure is low in the lungs, or normal. What happens is, as patients go into congestive heart failure, there's an early period where the pressures start to build up slowly and things start to back up. That pressure is reflected back into the lungs. So if we could measure the pressure of the blood in the lungs, we could tell when it was starting to rise. That would tell us way before the patient had trouble breathing and ended up in the emergency room. What this device does, the CardioMEMS device that we've implanted, is a way of implanting a small device within the arteries of the lungs that can take a recording from outside the body of the pressures. By monitoring this as an outpatient through a special monitoring device, physicians through the office can tell when the patient is starting to slip towards congestive heart failure and can call the patient and make changes in medications to keep it from progressing. These devices have equipment where the patient actually takes the measurement once a day themselves. It takes a few minutes, and it's transmitted over the phone line and through the internet to our office. Once a week or so, we can take that data out and look at it and look at the trends. If we see the patient is slipping in the wrong direction, then we call the patient and we tell them to change their medications. There's a major study using this device which showed that it could significantly reduce hospital readmissions. They showed that within 6 months, 27%, almost a quarter of hospital readmissions were prevented, and almost up to 40% of hospital readmissions were prevented in about 1.5 years. So the goal is to catch congestive heart failure in its earlier stages and treat it so that it doesn't progress to the point where the patient has trouble breathing, the fluid's backed up into the lungs, and they end up requiring a hospital admission. Currently, we only have one lab that we can do electrical studies in, and we can't do surgical procedures there at the present time. In the new heart center, we will have 2 electrophysiology or heart rhythm labs, and one of them we can actually is able to have what we call surgical backup, so that if we're doing very high-risk procedures, we can have a heart surgeon there if there's any issues or problems for safety.
Yeah, Dr. Kovach performed the CardioMEMS procedure, and we're very fortunate that it was the first one in the Quad City region to be performed. And the CardioMEMS procedure is a treatment for congestive heart failure. Well, with the CardioMEMS procedure, it's a small device that the physician implants in the patient, that the patient can then daily monitor their condition for congestive heart failure, and that information is downloaded to the physician's office, and the office nurses can monitor the patient on a daily, weekly, monthly basis to see if there's any trends and any changes in the patient's condition. Well, congestive heart failure patients have a high readmission rate currently. About 25% of patients that come into the hospital with congestive heart failure end up returning within 30 days. And one of the advantages with this device is that by that ongoing monitoring, we can catch a patient before they get to the point that they need the emergency room or be admitted to the hospital. And this will allow the patient to have a change in medication. It could be that they come in for a physician office visit, or whatever the physician would deem necessary to better care for that patient. Once a patient hits the emergency room and gets admitted for congestive heart failure, they end up being much sicker than what we would normally need them to be in their progression of congestive heart failure. As congestive heart failure patients progress in their disease process, you want to be able to keep them optimized and not get them to a level that they become very, very sick, because the sicker they get, the harder it is to return them to more of a normal lifestyle. We were very excited to partner with the physicians to be able to provide this care to the patients in the community, since there is such a large congestive heart failure population. I would see that we will be seeing this device implanted very frequently in the near future. We are so excited about doing new procedures, as we continually do ongoingly, with an example of the CardioMEMS procedure that has been done for congestive heart failure patients. And that aligns right with our heart center and the new building and the new facility that we are opening. We in the future have new procedures on the docket that we will be able to perform in our new facility. And the reason we haven't been able to do that in the past is because of the size and capacity of our rooms. But we are very excited about all of the new technology and the things that we can bring our community.